afternoon, and thank you for joining us on La Trobe News. This afternoon we will be discussing the topic of Do Not Resuscitate and the issues related to this topic. Do Not Resuscitate and Not for Resuscitation are defined by the US National Library of Medicine 2016 as a medical order in which is written by a doctor. NFR order specifies what type of life-saving treatment a person can receive. It covers issues such as life support, CPR and medical intervention. It specifies that if a person stops breathing or their heart stops, then doctors and medical staff are not permitted to resuscitate or bring the patient back to life via CPR or any other method. Resuscitation includes any measures by medical or health professionals that restart breathing and circulation and can include cardiopulmonary resuscitation, electrically shocking the heart into a normal rhythm, breathing tubes which keep the airway open, as well as medications which sustain bodily systems. There are a number of different types of DNR and NFR orders which cover a number of issues such as nutrition and hydration, pain and comfort management, and different levels of conscious states, including maintenance on life support machinery such as dialysis and ventilators. There are several ethical and general issues around the topic of DNR NFR orders. These issues can involve medical practitioners, family and the patient themselves. Doctors are often faced with the decision to abide by their own ethics in that they must not cause harm to the patient, while at the same time respecting the patient's right to make their own decisions about their healthcare treatment. They are often faced with making the decision of whether CPR or other life-saving measures should or should not be attempted. Family and patients, on the other hand, are faced with different issues, and they are often torn between two different scenarios. One in which they have to create a DNR NFR order for their loved one, and the second where the family is in disagreement and going against the patient's wishes. The patients are also often not in a position to speak for themselves by the time they create a DNR NFR order, and this often creates confusion around what a patient's last wishes are.
DNR and NFR can be very complex and multifaceted, with different ethical and moral viewpoints from a practitioner's point of view, a family of the patient's point of view, and especially from a patient's point of view. Due to how complex DNR and NFR is, there are many circumstances and scenarios that allow us to take a broad approach of the issues. For example, in a journal written by Hackler and Hiller, there are several issues acknowledging concerns about DNR in two different scenarios between family and medical staff. The first case discussed was an 18-year-old who died after 10 weeks of futile treatment, and the second a 6-year-old that died after 10 months of futile treatment. In both cases, the families were approached and given professional advice to seek a DNR order on several occasions. Similarly, in an article written by Adora Zotam discusses a case in which a 17-year-old male named Max, who has suffered from leukemia since the age of 7, has opted for a DNR, fully aware of what is at stake if he opts for a DNR or if he doesn't. Despite it being stated that his decision was fully autonomous, his parents intervene and are insisting to continue his various treatments regardless of his choices. Therefore, the confirmation of a DNR order has to be bring into consideration the views of the family, what the medical practitioners decide to do for Max's treatment in case of an emergency.
The cases mentioned by Hackler and Hiller in 1990 highlight several arguments and issues that involve practitioners, family, and more importantly, the patient. They stated that the medical staff involved in each scenario were left in uncomfortable and disheartening situations, forced to continually perform CPR on each patient, knowing that the patient would only end up in worsened states. Hackler and Hiller also provided an insight into the family's point of view, being left in emotional and horrific situations. The families were left feeling miserable and distraught after being given the wealth of knowledge that their children's situation and the fact that their treatment provided would only lead to a slow and painful death. The key principles concerned in these situations were autonomy, non-maleficence, and justice. Firstly, medical practitioners were left to decide which principle was more important to them, autonomy or non-maleficence. In each case, autonomy was chosen for the most important principle. Practitioners continued to abide by the family's autonomous decision to refuse DNR order, hence regarding their duty to do no harm to their patient. When comparing the two views from the medical staff and the family, you have to take into consideration the two patients' justice. Each patient was not given justice. The patient's life was fought over for an extensive period of time and therefore left the patients to pass in a slow and painful way. Similarly, the key principles in Max's case were presented by Azetam in 2012, were autonomy and non-maleficence. Azetam stated that Max's family had intervened with his DNR and were forcing practitioners to continue treatment, not wanted by himself. A solution had to be formed without breaching any policies or causing further conflict between each party involved. Throughout the dispute, Azetam highlighted that Max was continuing to suffer more and more each day, bringing the ethic non-maleficence into consideration. It would have been preferred to Max and his doctor that any further suffering was prevented, though Max was just 17 years old, and this became an issue. Azetam stated that Max was a minor and was in his parents' best interest to keep him alive, to avoid their son's death. Due to Max being a minor, only his parents can consent a DNR order despite Max's wishes, although it was reported that Max fit into the criteria of the American Academy of Pediatrics policy. This allows him to be classified as competent to make his own decisions, although his parents still have a higher right to his autonomy. Max gets a choice in most things concerning his health. Therefore, as mentioned by Azetam, practitioners have to choose between the parents' legal rights and Max's wishes.
DNR is a very complex issue morally, with a lot of facets and viewpoints which make it such a moral grey area, and why it's so hard to deal with or legislate for. One viewpoint would be, of course, the patient, who do not want to be resuscitated. Is their autonomy the most important thing in this situation? Or should it be questioned? If we question and discourage those who are suicidal, then why shouldn't we for those who have a DNR order and persuade them to change it, especially when they're unlikely to suffer from any side effects from the procedure? The other ethical viewpoint is that is life worth living if it's a life in pain, and whether it's physical or emotional. Another group to be considered is hospital staff and doctors. When should they resuscitate? Should they always respect the patient's wishes, or only work to benefit the patient's well-being, even if it goes against the patient's will? Or if they are morally or religiously can't let them die, and whether they should be liable for those decisions. It is especially complicated when patients don't have a clear or known DNR orders. How should doctors approach these situations? Lastly, there's the family of the patients. Is it ethical for them to write a DNR order on behalf of an incapable family member? Is it right to let them die, or allow them to keep living but suffer at the same time? There are also the factors that family members may not always act in the best interest of the patient or against the patient's will, and legislation should be written to avoid impropriety of a family.
It is clear that DNR orders are a controversial topic that lack clarity. Research shows that medical professionals lack the required knowledge of DNR, causing confusion regarding its meaning and circumstances of application. Training must broaden to accommodate DNR, especially to professionals who will practice in intensive care once qualified. Training should be stepped up during internships for nurses and surgeons. Trainers should focus on discussing DNR matters and providing clarity and methods to deal with different scenarios. Every nursing team should have an expert on DNR present during medical procedures, who is able to provide information on the patient's wishes and circumstances while providing expert advice when required. The legal definition should be known by everybody in an intensive care unit. Resuscitation orders have been neglected in medical training, which has led to much confusion in the healthcare industry. One of the main sources of confusion with DNR orders is an individual's wishes may be unclear regarding resuscitation. Some patients wish to be resuscitated in some conditions, but not in others. However, these wishes could be documented far better than they are currently. One reason healthcare professionals find DNR conflicting is that the decision often comes from a family of a patient who is unable to make the decision themselves. A database that includes an individual's preferences regarding DNR could be a way to avoid confusion regarding a patient's wishes. Individuals who wish to be resuscitated in certain conditions should lodge such requests in a government healthcare database or register their wishes before undergoing treatment when scheduled. In order for such changes to occur, society's knowledge on resuscitation orders must be enhanced. The public must know that they have choices on resuscitation.
Now we come to the end of this segment. We hope it has been informative program and that you've come out of this more knowledgeable about the various issues of do not resuscitate orders. Would it be something you would consider in the future? Or perhaps you will have to deal with it as a healthcare professional or with someone you're close to. DNR orders can be hard and an emotional thing to deal with, so it is paramount that people have a thorough understanding of it to make the best decision they can when they have to.
Thank you for listening to another segment on La Trobe News.